Done?
I think that we
All
can.
right. Okay. Welcome, everybody, to our Finance and Revenue Committee of the Universal Health Plan Governance Board. I was going to say this is our some number of committee meetings, but I just honestly don't remember which number it is. So thanks everybody for attending. I'm looking forward today to really laying out a timeline with the deliverables for this committee together with our consultants, Echo Northwest, and further defining the committee's role versus staff versus consultants. I think that will be really helpful moving forward, and our intersection with other committees as well. So with that, we'll start. I don't think we need a tech check because we've done this a few times now. So we'll just, did you want to do an intro first, Mimi?
Yeah,
Okay.
I would like to. So good morning, everyone. This is Mimi McDonald, Executive Director of UHPGB. And I am delighted to announce and introduce you to Isabel Cordelis, who under her name, you can give a wave, Isabel, so people can see you because it just says UHPBG staff. Isabel is our new executive assistant. She comes to us with years of experience, and I am delighted and grateful, and I think you all will be delighted and grateful that it won't be just Kim and myself running Zoom and things. So we hope that this will also improve our communication. So happy to have Isabel on board. And I will then do the roll call. If Isabel will check people off on the list as we go along. So starting with Cheryl Ramirez.
Here.
Chinwei Chi. Mary Lou Henrik. I see that she's here, but I'm waiting for her to get.
I'm here.
There she is.
I had to get off mute. Okay.
Thanks, Mary Lou. Richard Gibson.
Here.
Thank you. Jeff Goodman. I don't see him on the list. He may not be here yet. Chris Hogan. John Santa.
Here.
Thank you. Bethany Stairs. And Charlie Swanson.
Here.
Thank you. All righty. Well, we can roll. You can advance the slides a little bit, Isabel, and I think we get on to, you can skip that one and go to today's agenda.
Okay, so we'll start with a summary feedback from our last meeting, and since I wasn't here, Mimi's going to do that. She'll also go into committee updates, that is from other committees, so that you know what other committees are doing. She'll do a brief review of the strategic planning meeting that the board held, and I know a couple of you were there. And then we'll move into Echo Northwest, orientation and framing of the work, and you've probably seen those slides already. And then we'll do, as usual, our reflections and talk about the next meeting topics. We'll do public comment if there is any. So that's what we'll do. So now I'll hand it off to Mimi for the summary feedback.
All right. Yeah, if you want to advance the slide. So just the things that that were discussed at the prior meeting, spent a lot of time talking about, and Kimmy presented Milliman and Echo Northwest, their scope of work discussion, and some things that came up from the committee members as being wanting to be called out and make sure that they were addressed. Obviously, the importance of being able to have some kind of federal waiver, in other words, way to ensure that the finances from the federal government are going into the UHP, and then also the importance of addressing the availability or the funds that are in the trust fund not being subject to the Oregon kicker. Other things that were brought up, certainly we had a robust discussion around administrative costs, again, kind of specifically focusing a little bit on the provider side of the administrative costs and ways to ensure that when they're setting a cost budget that the UHP is taking into account all of the potential administrative cost savings. And so to that end, we talked about creating a understanding of cost assumptions with the consultants. And I'll just say that we do have our HMA consultants are working on a presentation for that for our next meeting with this group. And then also the staff are working on collating all of the questions and sending them out to subject matter experts, and either having a, depending on the responses, either having just a presentation or an actual meeting with those experts to provide information. And of course, starting with the Joint Task Force recommendations as the baseline of that administrative cost. And then again, lastly, I think the discussion around ERISA is, of course, obviously there's a lot of work done with the Joint Task Force and recommendations, and then just to ensure, especially for this committee as the work moves forward, taking into account the potential for ERISA being contested. The way that this is framed, of course, is related to the funding that has to do with employer-sponsored health plans. So that was kind of our feedback from our last meeting. And then next slide, please. I'd like to go on and talk about kind of what some of the other committees are up to. And so this is something that came out of our last meeting, and other committees as well, really appreciating that we as staff would like to ensure that all of the committees have an understanding of what other groups are working, because of course there's a lot of intersectionality about that. So to that end, we'll kind of do this committee update at each of the committee meetings, talking about what the other groups are doing. So starting off with the Community Engagement and Communications Committee. So the work that they are currently on is developing what's called a style guide for UHP documents to ensure that there's inclusive, trauma-informed verbiage. And so Kimmy has been developing that through some work that's already been done through OHA. And then of course, that's going to go to the CECC committee for discussion. That'll be happening at their next meeting. And then Patty Wentz, who's a consultant who some of you may be familiar with, is also in the process of being contracted and being brought on board to work not only with the CECC committee, but also with the board to really enhance the ability to have a sort of unified messaging, and messaging that is very in plain language and is easily not just easily understood, but that really speaks to all of the people that we're trying to interact with, and all of the different stakeholders and people in the population, people who live in Oregon. All right. So next, to update you on the Plan Design and Revenue Committee, they of course have some very big tasks in front of them. They have completed their draft, so they're of eligibility. So they have a straw proposal that has not yet been finalized to go before the board. They have completed a behavioral health straw proposal, and that actually has been approved by the board. So we'll continue to do that work and revise it to be included in the final report. Long-term support services straw proposal is also in development. And because that's such a large topic, there's being a subcommittee developed around that. At the last meeting at Plan Design and Revenue, the HMA team of consultants did a review of the provider reimbursement strategies that were set out through the Joint Task Force. And then there is also then going to be a work group in development to do some additional work on that, and then bring it back to the larger committee about provider reimbursement. Again, that's a big topic. So they can develop their sort of proposals to go before the board. Last but not least, operations. They have completed a public corporation straw proposal, and that was approved by the board. So that work will keep moving forward. The federal waivers report was reviewed by, again, the HMA consultants, and reviewed at the committee level, again, to, to educate the committee members and have them thinking about what has already been done. Treasury Fund straw proposal has been reviewed at the committee, and it's going to be sent to the board for final approval. So, yes, Jeff Goodman.
Thank you. Thank you for the updates on the three different groups. A question about the public corporation straw proposal, board approved. This will then be it's two parts. One, just to confirm, a separate and distinct organization from the OHA. And secondly, if it is a separate and distinct organization from the OHA, what happens to the OHA? Thank you.
Yes. Thank you. So I don't know that. So from my understanding and my reading of the straw proposal, it is indeed a separate and distinct organization from OHA because it is not, that is the proposal that is set forward. I don't think that they have, and it's very, very high level is that straw proposal. So I don't believe that they have gotten into the details of that, which of course is a very germane and excellent question. So more to come on that. Thank you.
Just as a broad statement, I understand it's high level. A high level response is the OHA is already in place. Are we reinventing the wheel? I understand it's high level and you can't answer the question, but that's something that just comes to mind. Thank you.
Absolutely. Thank you. And I think Mary Lou, you have your hand up next.
I don't have a specific answer, Jeff, but OHA has a lot of other functions and it is clearly still part of state government. I think this proposal is to not have it be a direct state government run plan. So that's at least my understanding. I think it's a good question to raise.
And you bet. And just to if I might follow on to that, I mean, I appreciate that they do have a lot of other functions, but based upon the level of coverage that I understand is being discussed that's going to be provided, my default mode is it seems like we're creating two separate administrative health authorities, for lack of a better word, to do this, because we are going with a very broad coverage that is looking to be provided. Again, I understand it's very high level and we'll get more detail as we go forward.
Thank you. And Cheryl.
That is a really good question, Jeff. And I would say the Oregon Health Authority will still be the regulatory authority. They still have licensing and certification. And I do not believe this plan will cover all of the health and social services that people need. I can say just from my experience with the behavioral health system, I do not believe this health plan will cover everything. So I think there will still be a role for state general funds in health and again, the regulatory function. So that's how I see it, just based on just thinking about it the last few seconds since you asked. Because like Mimi said, we didn't get into that level of detail. So thanks for the question though.
All right. Thanks, you guys. That was a really, I'm delighted that it's prompting some discussion. We'll keep that going as a regular part of our agenda. All right. John Santa.
Yeah. I assume it's okay to ask, under the provider reimbursement topic, so will that committee, the PD&R committee, be responsible for the analysis of the normalization of provider reimbursement? And as part of that, identify in terms of that big shift of funds, what's going to be the impact on providers? Which providers are going to benefit from that? Which are going to end up not doing quite as well on that? You know, from a financial point of view, I think it would normally be important to us to know what should we expect, if anything, from that. But it sounds like they've got that topic. So will we see that analysis eventually in some form or other?
Yes.
Thank you.
Absolutely. No, that's again, excellent question. And yes, and I can, well, anyway, we'll go on. So I don't want to take up too much time. Let's see, how are we doing? Oh, we're doing great. So I actually, if we're done with this, I'm going to move on to a brief update of the board strategic planning meeting, and I'm going to share my screen. All right, hopefully we're good there. So the board met, and Cheryl Ramirez and Mary Lou are going to be able to chime in too for sure, because they were there as well. And I know some of you other committee members attended, which you definitely appreciate. So here we go. So the meeting started off with a discussion around the mission, values, and principles. And what we have up here is some of the, I'm going to call it artwork because it is Board Chair Richardson, Dr. Judy Richardson is also certified facilitator, and so was able to create some amazing, these were, huge documents that she created and was able to share, and people were able to write on in real time. And so what I would say is that, using the core principles, there was a discussion around the mission, and what kind of one of the topics that came up, just looking at the mission, and you can see that there's strike throughs and some arrows and other things showing that this is still going to be a work in process. But I think what really came through is that the mission that was sort of written down there was good, but it was very operational. And what the board felt was like that there still needed to be some work done on that mission to really encompass sort of that that patient-centered care, that the individuals are, at the heart of all of this work that's happening. And so certainly that's one of the tasks that's going back to the Community Engagement and Communications Committee, is to review this and workshop this. And then I just wondered, Mary Lou or Cheryl, if you had any other thoughts about this part of it.
I would just say it was really helpful to crystallize our mission and why we're here, and that we're in it together. So, and I have to say, I loved the drawing. That was so great. It was helpful to be creative and think about things in a different way. So I really appreciated that.
I know, I don't think I'm describing it very well. These huge, sort of like pieces of paper were about the size of an old chalkboard, if y'all remember chalkboards. All right. And then next, the next part was, this is a longer discussion, starting with the robust discussion of the current state, which is not looking so great, and then sort of going over to the future state of what the board would really like to see, and then putting forth all of the process steps, but then also these stepping stones that are in the middle of that work. So take a second. Sorry, this is all going to go, will be posted and will be in your slide deck. So there is no quiz on this today, but just so people have a sense of that sort of journey or bridge or whatever you would like to call it. And I will sort of, one thing that I will call out that I know that the board talked about, you can kind of see those ovals that are in the middle and sort of under that rainbow-ish looking bridge, and they were referred to as stepping stones. So they are certainly work that is required in the process to get to that future state, but they also can be things that are essentially standalone parts of work. So as they are accomplished, those can be functional even prior to that entire future state being functional. So for example, a uniform fee schedule is something that could be a stepping stone, that is something that's accomplished maybe before we even get to the future state. So I don't want to spend too much time. This discussion went on. And again, Mary Lou and Cheryl, if you would like to add your comments, because it was a great discussion. Yeah, Mary Lou.
This is Mary Lou, excuse me. I've had a cold and I sound a little weird, but okay. One of the things that did jump out here with me was this stepping stone about plain language, communications campaign, etc., which was kind of alluded to on the previous slide, or where we were talking about consultant Patty Wentz, etc. And I guess all I want to say is, I've worked in government bureaucracy and in public health and all of these healthcare arenas. And I really, really hope we stay away from kind of the politically correct language of the day. That kind of, that the normal person, I mean, I hope we're going to do something that I can talk to my next door neighbor and say, look, this is what we're trying to do. And this is what it is, and not get caught up in, I'm sorry to say, but a lot of inclusive, trauma-informed language, whatever that means, because I've seen lots of efforts to make it plain, but it still keeps coming out as, what are you talking about? And anyway, that's my only thing that I would say back, is that please, let's get it so that it is plain language communications campaign, as that stepping stone says. That's all.
Thank you. And Cheryl.
I would just say again, we know all of these things. It was really easy for us to generate the current state and how bleak it is. And also the stepping stones, we know all of that. And to see it laid out like this, and then just to spend a little time again on our vision, because we all have the same vision. We know where we need to go, and now it's just a matter of how we get there and which steps to take. So I just liked this illustration. It made me hopeful. I mean, it's daunting too, but but I felt some hope and positivity after seeing this.
All right. Another part of that discussion that really came out of that that sort of work grouping thing. Mary Lou, do you want to say something else, Mary Lou, before I move on?
Yeah, one last thing. It's just because I was looking, can you back up on the
yeah,
slide?
would you mind going back? Oh, that's yeah, Isabel, can you go back? Let me go. Oh, there we go.
Okay. The one that, as I was just getting ready to have you go on, the cost calculator. I think that many, many people, as I've talked with friends and family and neighbors and you name it about this whole idea, one of the very first things everybody jumps to is, well, how much is it going to cost? What it's going to mean for me? How can I know whether I like this thing or not? I'm not happy with what I've got, but oh my gosh, et cetera, et cetera. And so I just thought it was interesting that, I don't know if it was you, Mimi, or Helen, or who brought up and said that, I think it's Echo Northwest. I believe they're on this call, and I believe they're going to talk about things, but that, oh yeah, that's easy. We can do that. So anyway, I'm glad it's easy. It seems daunting to me, but anyway, that is one thing that I think is just the general people out there that want to know about this thing. It really comes down to, how does it affect me? And that having something where we can really say, put these numbers in, try to find out these numbers, because a lot of people don't have a clue really what their employer is paying right now for their premiums, or what even they're paying exactly, and don't track it all that well. So anyway, I hope it's easy. Thank you.
And I actually think it may have been Milliman, so, but I'm not sure because I wasn't in on that conversation.
Okay, all right, maybe it was Milliman. Okay, we'll grill them then. Okay, thanks.
And I think it's easy was truly in quotation, meant to be a little bit ironic, because I don't know how easy we truly believe it to be. All right, so then yes, so again, the other thing that I believe came out of this discussion was sort of where deliberations take place about certain decisions. And so kind of that referred to as the decision level. So is this a committee level? Of course, the committees make recommendations to the board. We know that. But is this something that should be debated and decided at the board level, or is this something debated and decided at the committee level? And so there was some discussion about that. And so this is, I have a one that you don't have to go through all of this, but this is what this looked like just for people. And I'm just, so this is in here, but what it was summarized, I'll summarize it on the next slide. You don't have to do too much same. So sort of under action items, and on the left-hand side, sort of board level type decisions. Again, certainly not that there won't be input from the committees, but you know, that is where there may be some more again, discussion and debate happening at the board level. A big one, and this has a lot to do with operations and plan design, which is, you know, what is the definition of this regional entity that was brought forth from the Joint Task Force recommendation, and what is the footprint? We know the Joint Task Force recommendations about risk bearing, that all the risk should be at the state, but is that truly what is wanted? And how is accountability, which may not be in the form of risk bearing, but how is that taken into consideration? So board level decisions, they also had established, you know, completely confirmed the eligibility. Obviously that's happening on the plan design committee level, and then moving it up, delivery system structure and payment model. And I think John sent this, I think this is part of kind of what you were talking about. And of course the impact on providers, and that there was a discussion about, well, you know, if you do have this uniform fee payment, you know, what is the danger of losing subspecialists possibly to another state if they have a big reduction in fees? So I just want you to know that's all kind of, that is all within the gamut of things being discussed. The financing strategy, of course, with respect to the cost target. And then, you know, what came up a lot is the challenge of the communications and community engagement team. Like, well, we have to know what we want to communicate. And so just making sure that the key concepts are all aligned within the framework of the of that committee's work. And so then that they can share that out. Things that are noted at the committee level to sort of have more deliberation at that level. First, plan design, benefit limits, and then what happens when they're, you know, how can they respond to financial constraints? Because there, you know, will not always be a guarantee of, you know, certain funding sources. Also, of course, it's more of an operations, the IT system requirements for cost and health. I talked about this. Oh, I should, you can see ECC, that was a typo on my part. Community engagement, the potential of community engagement councils and what that would look like. And then there were just a couple other questions that were brought up that we bring forth to the consultant groups. Mary Lip.
This was done, wait a minute, okay, all right, I guess I'm off. This was done at the very end of the meeting. And I don't think I was even really processing. I think it was Judy who was taking things off charts. There was just some discussion, but I think this isn't cast in stone, at least from my perspective as a board member. I think that you know, and maybe it's just that I'm on this committee, but it feels to me like a lot of the stuff around, you know, finance and revenue really needs those. Of course, it goes to the board for them to act on, but this kind of makes it look like the board is doing all this work. And I don't see that being the case, at least as a board member, so far as I am at this point. The most involved I am is joining this committee. And then, you know, I've only been to 2 meetings, and one of them was this long one. So I may be speaking out of turn, but I don't know, it makes me a little nervous to kind of have this and look like it's, you know, it's fine when you've got it all on your pretty paper with your pictures and your arrows and your whatever. But when it kind of comes up like this, I kind of went, oh, really? So anyway, I don't know, Cheryl, you've been at this a lot longer than I have.
No, I was just going to agree with your perceptions. This is certainly not a complete list, and yeah, it was done at the very end, and it feels like just bits and pieces, so it's not complete at all. And we may want to, we may want to share that caveat, like this isn't set in stone, it's not everything, and it isn't that the board does everything. It's they make the final decision. So yeah. a lot of the work is actually done through the committees for
Yeah.
sure.
Maybe you could have a big draft on it or something like that. It's just, I'm thinking as this kind of thing goes out to the public, kind of like people take it and say, oh, well, I read this. And anyway, that's all.
Thank you. Absolutely. I can certainly do that. I just was sort of, yeah. Oops. No, we're just going back willy-nilly. Apologies. Okay. Yes, and absolutely. I can make that distinction. A couple of implications that did come up for the timeline, though, and then looking at all of these, and I think the Finance and Revenue Committee, and again, this is, Cheryl, you can talk about this, but one thing that came up was that certainly didn't seem like the work would be done in August, at least extending through October. I would have said November, but this is all up to you. So if you guys want to chime in on that one.
Yeah, I was, if you took a peek at Echo Northwest slides, it's actually extending through December. So I figured no way could we be done in August. And so I feel actually more comfortable with that extension. And I just wasn't sure how long Echo Northwest would need to complete their report. So I didn't want to push it too far, but it seemed right to me.
And then just for the, there were some things about the Community Engagement Committee. Obviously, some of their work has been pushed back. Partly just it's been taking a little bit longer to get one of the consultants on board just because of our staff changes, but then also kind of having the content to share sort of shifts their time frame a little bit too. I think they were thinking about having some meetings in the summer, and that's definitely pushed out for that. It does appear that I just saw this in the plan design on track for November 2025. So yay for them. Okay, and then, Cheryl, please.
Just really quick, we didn't talk about operations and transitions, but it seems to me that the transitions committee that isn't even meeting yet needs to be pushed back too, for obvious reasons. So it seems like maybe there's a 3-month lag or something like that from my point of view for transitions.
Right. Thank you. And then I know that, Charlie, would you like to add something?
Yeah, so relating to the transitions, it seems to me like Finance and Revenue would have a lot to say about transition planning, and I'm wondering if that is going to be the case. Is it, we're supposed to be done in, I guess, October or maybe December or whatever, and I'm not sure where the transition plan is going to be, but that relates a lot to Finance and Revenue. So I'm wondering how that relationship is going to work.
Absolutely. And I think that was something that has been brought up. And I think that there is discussion at the board level about, well, would it make sense then to sort of, for those, sort of like have a super group, as it were, of people who have been involved and are aware and have been through the process. And then if they would be willing to, continue on and be part of that transition. So I don't want to speak, this definitely is not, has not been decided, but I think that it was discussed, and sort of the importance, which I brought up, is sort of all of the committees to have that at the forefront of, yes, we always need to be thinking about what the transition will look like. And as Mary Lou often said, it's not just that we're doing a report, like we're wanting something to happen at the end of it. So I think that's a great point, Charlie, and it's still under discussion. Thanks, Mary Lou.
Well, I've seen this now 2 or 3 times, and Kim did it, and I think it's probably excellent, but it is always too small, too far away. I can't really read it. I am sitting here putting my face up to the screen, and I don't know what we can do.
If you will allow me, I'm going to advance it
Okay.
just one slide. So this is like, this is the whole enchilada. However, I am now going to serve up what Kim made, which is bites of the enchilada, as it were.
Okay.
And so hopefully that this will be, and Cheryl asked, I know this is something that we went over in our last meeting. No, Cheryl wasn't here at that one, and she just asked for us to share this. And just so you guys know, it will be posted, this was sort of completed after the meeting materials were posted, so it's on a separate slide, but it'll go up on our website. And I'm just going to advance forward. I'll come back to this one in just a second, but we also have this for operations and plan design. Oops, and there is another, I don't know why it's not on there. I must have missed it. I'll make sure it gets on there. The community engagement, but this is just a little reminder to have. And let's see, I think we are well ahead of time. And so if there's any more comments or thoughts about kind of where just the past couple of topics, otherwise, if we're okay, I will turn it over to our Echo Northwest partners. John.
Yeah, I mean, I'm just interested after it looks like our task finishes sometime in 2025. And so then the board has a series of committee reports, and I assume needs from those to put a package together that makes sense. And usually in those processes, you're going to find, you know, some conflicts. Like, let's say Finance and Revenue says, for all practical purposes, we think that X billion dollars in revenue can be raised in taxes, and even that will be a challenge. So there should be no more than this amount budgeted by the Universal Health Plan. But then you look at the plan design that's come forward, and it's in excess of that. So what happens? The committees are gone. Or let's say that we do our work and generate an estimate, and an outside powerful source of some source says, well, just to let you all know, there's no way we will politically support, you know, this degree of a tax increase. And you might want to consider that before you sign off on your final report to the legislature. I mean, I would assume that the board will be looking for other you know, organizations and all for support of this report, and that there will be, to some degree, a feedback process. So in other words, I kind of see a process during 2026 where there will be a lot of back and forth, and
yes,
what can we do here? What can we do there? What really is our priority, et cetera, et cetera. So I'm assuming that what the board is saying is that they will do all of that.
well, I don't want to speak for the board. I might have to let Cheryl take this one. I think that from my understanding is that, yes, that iterative process will absolutely go on. It doesn't mean that there won't be, that it will only be those 8 or 9 people who are on the board doing all of that work. I think just as we anticipate a transition committee evolving, I think that other works will be evolved. And certainly the work of the board is not going to end on September of 2026, just because the report is due. So I think that right now, the strategic planning meeting was kind of focused on certainly on further down the road, but a little bit more like alignment. So I'll stop talking. I'll let Cheryl speak. Apologies for jumping in there, Cheryl.
Oh, no problem. So I'll just give my response to John first, and then I did want to say a couple more things about the strategic planning takeaways for me anyway. So first, I still see us meeting with the plan design committee and probably also with the communications committee, or at least scheduling time where we would give the communications committee direction for getting public input on our ideas, on our recommendations, proposals. And then we had semi scheduled a meeting with plan design. I think it was originally scheduled for maybe June and maybe pushed back to July. So I actually have questions for Echo Northwest as they're going along the timeline on when they believe it seems right to schedule with the committees to have this interaction. So we're not just plowing ahead like parallel tracks and we have our own proposals and they don't mesh. So I'm hoping that we will have interaction with the committees in between. And some of it will happen at the end, but I would hope that we can get things kind of more worked out as we're going through. And so that is a question I have for Echo Northwest, and hopefully they can address it when they're going through the timeline schedule. And secondly, I just wanted to mention that for me, it was most important to resolve timelines and deliverables, roles and responsibilities between the committee, the consultants, staff, and the board. And I feel like we got there, and especially with Echo Northwest, just really sketching out what that timeline would be and what we're going to accomplish each month. That was helpful to me. I wanted more specifics on the process and our charge as the committee, so it was really clear. So that's what I wanted to get out of the strategic planning activities. And for me, this finance and revenue work stream is helpful just to remind me, okay, this is what Milliman's doing, and this is what Echo Northwest is doing, and these are our responsibilities, the committee. So I just feel like it's a really good reference for us to have in our back pockets. So that's what I have to say. Thank you.
Thank you, Cheryl. Charlie, I believe you are next.
Yeah, I just want to mention that my internet seems to be a little unstable, and so I miss a little bit of what's going on. I'm catching most of it, I think, but so I might have missed something. But I want to go back to some stuff that John had said, and a number of us on the Finance and Revenue Committee think that among the hardest and most important things in our job of getting the public on board with this is going to be related to the tax structure, and that we're going to need to get an awful lot of feedback from the public on, is the tax structure reasonable to them? Does it make sense to them for what we're trying to do here? And once you get that feedback, then somebody needs to respond to that. And I think the Finance and Revenue Committee is going to be best suited to be responding to that. I don't see that the board as a whole is going to be able to do all of the necessary work. So I just think it's really an odd thing to stop the Finance and Revenue Committee so early. It just does not make any sense to me. So I'll just stop there.
Thank you. Yeah, and that absolutely, that's noted. And I apologize for continuing to say that some of these things are still in development, because I know I've said that a lot, or it's an iterative process. So I apologize for that. And so I just want you all to know that we're absolutely hearing what you're saying and taking it down, and will all be brought into the discussion in the ways of moving forward in a way that facilitates, like, sort of like the most streamlined fashion is what I'm trying to say. So in other words, it may not look exactly like it does now, but all of that work that you're mentioning and talking about, and the people who are the subject matter experts and who've been involved from the beginning, certainly will be involved. So I just wanted to throw that out there. Thank you. And Mary Lou.
I think my comments are somewhat like Charlie's, and maybe John's, that I came into this in the middle of the movie, and so did you, Mimi. And so I think that maybe kind of onboarding and really kind of getting clear on these various roles and what's going on and what's anticipated, et cetera. I'm still kind of fumbling around trying, and I'm not, there isn't really a lot of ongoing expertise to go to on some of this that was, you know, done before my time. But I agree that one of the things that's been kind of rattling around in my head is I have, you know, great respect for Diana Bianco and for folks that are going to be doing the community listening on the various groups. But I'm not sure that kind of sitting in and listening to some of that, depending on what the, you know, there'll be a lot of fine points or a lot of things that, you know, maybe could be teased out from somebody giving X, Y, or Z, you know, well, this is what I think, or blah, 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 and kind of shutting the discussion down, or just kind of, you know, folding their arms and saying this won't work. And I think there could, you know, be that kind of response. And so I am thinking that the people on this Finance and Revenue Committee, certainly not me, since I'm a late joiner and this isn't, you know, my total area of expertise, but I feel like we've got people on here who have been struggling through this and will continue to struggle as we, you know, really do come out with a proposed tax structure. And I don't know, somehow I'm envisioning that, you know, these input meetings or whatever, and they're kind of over here and somebody's taking notes and coming back and saying, this is what happened. And there's not really the interchange or the stuff that will really, in my mind, make or break this down the road. So anyway, I just am a little befuddled about some of this, and I'm trying to not be critical when I probably just don't understand.
So if I'm hearing you, what you are saying, and I think Cheryl was alluding to this as well, is the importance of the work of finance and revenue informing the communications and that feedback loop being there, and the sort of the same with operations. Sorry, I don't want to put words in your mouth, Cheryl, but that there is a sense that that is not robust right now, and that's something that should be worked on and continue to be developed. Is that what I heard from you anyway, Mary Lou?
Pretty much, yeah.
Okay, thanks. I'm just trying to make sure. And Cheryl, yes, please.
Well, and I take the point that we need to refine or better articulate the role of the board versus the committees. But my perspective is that our committee does have interaction with communications and is involved in those, in gathering public comment. It's just that when it comes to a final decision on a proposal, that goes through the board, but I still think we're able to be involved right there on the ground and get that feedback to help us develop our proposals. So I don't see that as being like we're not in it. I mean, I think we are, and then we just then develop our straw proposals based on that feedback we get from the public, and then the board, you know, votes on it or asks us questions or you know, asks us to further define our proposal. That's how I see it. It's more about the decision-making process than doing the actual on-the-ground work. That's how I view it. But we need to probably bring this up with the board just to clarify too.
Excellent. Thank you all so much for that discussion. I think it was really helpful. So if we are ready to move on, I'm going to stop sharing my screen. I will ask our Echo Northwest team consultants if you would like to share your slides and drive yourself, or if you would like me to share my screen and drive.
I will drive and I will send you. I updated a few more slides just.
Okay.
I was like, I'm missing kind of a transition or some good talking points. So let me go ahead and do that. Okay. All right. I will move into presentation mode. Okay. Can everybody, oh, hold on a sec. All right. Am I sharing the right version? Not my talking points, but actually.
Yes, it says May 20th or May meeting.
the dual monitor thing. You never know what screen I'm
I
doing.
know, I know.
So let me just start with this, some context and just a little background. So again, Morgan Shook, Director at Echo Northwest. I work in lots of different domains, but tax policy and healthcare. Well, healthcare is an old piece. I used to work in health disparities research at the University of Chicago many, many years ago, but have since been a consultant. As a consultant, I have supported groups like this as staff directly. And then for various things, I've also served on these types of committees and as chairs of these committees. And I understand you're kind of running a process, right? A process where you actually have a charge you have to fulfill, but each one of you here is bringing your own sort of strengths, perspectives to the dialogue, and you have to kind of be responsible for delivering that and do that in both a substantive way, feeling like you've dealt with the material, but also in an emotional way, in the sense that you've contributed in that and you feel like your voice is heard and that deliberation has been respected. And so when we were brought on board, we spent a lot of time reviewing materials. We were able to join a couple meetings. We've had a chance to obviously speak with your chair, Cheryl, but also get in sync with your new executive director, Mimi here. And what I suggested was, it seems like, and maybe Mary Lou might have prefaced this, it seems like maybe a good point to kind of do what I'll call say on a level set. You've had a lot of change. The board is onboarding subject matter consultants to help carry forward a lot of this analysis. And so let's just maybe stop and say, and I think the strategic planning process was the point to say kind of where are we? Let's get a roadmap for where we need to go and fulfill our charge. And so what both the chair and your director, Mimi, asked us to do is kind of, hey, can we kind of lay this out in a way? And so what we're trying to do is help clarify and organize the work that the committee has already begun, right? And to really have a sort of clear shared framework for moving forward, one that honors the work you've done, but also prepares us for the recommendations still to come that you have to make in the time moving forward. And so, so I kind of used that background kind of as a consultant, but also as a chair and committee member to say, like, how can we do this in a way that feels, everybody feels great at the end, right? You've dealt with it, you've contributed, and we're all on board and moving in lockstep. That is the sort of goal. And so, like I said here, our role here is not to do the work for you. We are here in service for you to answer questions that you have been charged with that are within our scope. But I think also we can't really do a great job unless we also kind of have a game plan that we feel like we're working as part of a team with you all. And so today's level set in the first part of this agenda is really just to kind of make sure that we are seeing, based on what we've seen, and that, I mean, that's not everything, is to get your feedback around sort of clear meeting agendas, setting good expectations around the deliverables so that you feel you can deal with that information as clearly. As I said, alluded to a little earlier, right? This is not a redo of any past work, right? That is all great stuff when we want to build on that. And we want and it's not sort of staff saying like, hey, we want to seize back control, or the other board trying to seize back control and rewrite or do any of that work, right? This is really just a structured way to bring your work into clear focus, help set the pace so you kind of know where we've been, where are we going, and that there's room for dialogue and refinement for your work. So what are we trying to do? So I think the first thing here is really reflect back the great work that's already been done, right? We don't want to redo any of that. We don't need to relitigate that. But in looking at some of that, I feel like there's some opportunities for us to take a lot of that and turn it into a clear work product, right? Here is a document. Answer is a question that we have, right? So it's help building the thing that you have to submit at the end of this year. And so part of it is really just to make sure that we kind of understand where you've been, you've had some time to reflect, but really to turn those things into actual work product that in some cases that you have to sort of vote on in terms of recommendations or that have to be turned into deliverables. To me, I think as you've alluded to here, there is sort of a lot of overlap with respect to these issues that the other committees are taking a look at, that I'll have to feed up to the board. And what I've heard here is like, there needs to be some conduit around, hey, we think this is important. this committee needs to understand this important linkages, or this committee is doing this. We need to understand what they're doing. And talking with Mimi, that's I think likely to be a standing agenda for all committee meetings, is to understand kind of that two-way sort of crosstalk that needs to happen. A lot of that still is probably TBD because it depends what happens, but I think that is a key piece. And so for us, it's really to find clarity about what still needs to be studied in terms of your existing work program and make sure we make those linkages. We're talking with your chair, Cheryl. It's also important that for her, like, we create a roadmap for committee deliberation around some of these issues, and particularly decision making when you have to sort of provide either recommendations or to issue sort of work product. Because you have two big things that you have to deliver at the end of this, right? There is a set of research tasks and questions that you have to kind of turn into some deliberative document that provides direction and insight to the board. But then there are some very specific board ready recommendations that have to happen. And so I want to tell you a little bit about our process here at ECHO about how we did this. And the consultant hat is always like, okay, what are you responsible for at the end? How do we create a work back plan? And so for me, it was really to start kind of generally with the charge that you have been given from the governing board in terms of the research tasks. Turn those, I think, those tasks into kind of questions. I think ultimately you're trying to ask, are we at, a question then allows us to kind of devise a set of research methods to test it and to provide sort of findings and some discussion for you. So I think part of it is sort of take a little bit of tasks and to kind of take those into questions. We want to then map those questions to your future board meetings so that we can understand kind of like, well, that's a lot of stuff, and meeting once a month is a lot that's already being asked of you from a volunteer basis. I know you have some supplementary meetings. We don't want to tap into those if we don't have to, but if they become things that we have to manage in terms of the pace, like we have that available to us. And then it helps the consultants, both ECHO, UHP staff, and then Milliman, right, make sure that we are kind of supporting you with the right type of analysis so we can, a lot of these things are difficult to do and we need lead time to kind of prepare them as we kind of move forward. And then, finally, deliberation, final recommendations. So that's how I've kind of thought through our process in creating this kind of, we'll call it a working work program, because it'll likely change, but at least we have a place to start and we can keep revising this. I don't need to spend much time on this. You've all seen this. This is your set of required areas of study that are as part of the committee charge, right? You have a variety of different pieces. And what we're trying to do then is to say, link that to what you then have is deliverables and recommendations. So as part of your charge, right, you have to deliver a report and recommendations for a preferred financing framework and a set of revenue scenarios that can fund universal health care. You have to talk about some of those trade-offs with respect to stability, equity, legality, administrative feasibility. You have to recommend startup and reserve strategies, including sort of pre-implementation funding needs. You have to sort of then provide a preferred transition pathways around how do you move the current healthcare financing and funding and financing model to a more unified publicly funded system. And then you have to provide a set of clear decision criteria for evaluating that financing and funding approaches over time with respect to, we don't know yet, is it not raising enough money? Is it not showing fairness, right? So we have to have some discussion there. So I'll just pause and we'll get into kind of what we think the questions are, but then also how do we map that to a schedule. And I think for that conversation, I'm really looking for feedback from you. Like, are these the right questions? Hey, we've already covered this, maybe, but what I really want to be able to talk about in this little aspect is something, right? So we'll get into kind of the nitty gritty of some of those pieces. But in terms of why we're doing this, how we kind of set about our approach, any questions thus far? Great. I'll take silence as a strong consent. Oh, there we go, John.
Yeah, just I think in some of the language that we saw around your approach to this. There was mention both in your work and Milliman's that you would develop a model. Because I think a lot of these questions can only be answered if there is a model so that the committee can see, well, if long-term care is to be added as a benefit, here is what would happen from a revenue point of view. Or if the board wanted to go to regional entities that take on risk, here is what would happen in terms of the administrative cost of the plan. So none of these deal with the model, but I just want to make sure that we're going to have something like that. And I mean, I think Charlie's gone a long way towards establishing what I think is the start of that model. And I'd like to acknowledge that and you know, get that coordinated and hooked up, because he and Richard have done terrific work on you know, starting to build that model, I think.
Yeah, and I will just say it's not one model, there'll be multiple models, right? Because I think what you're being asked is to ask a bunch of what ifs, right? And so we have to have some working understanding of the current situation as well as sort of new scenarios, right? And how it changes specific types of things with respect to sort of equity, payments, you know, reliability, adequacy, right? These are some of the key questions you're being talked to. So yes, there won't be just like a model, but there'll be multiple models given the context. But I think all of those models are really trying to be responsive to questions that you want to ask, right? What if it's a little more of this? What if it's a little less of this? How does that change some of the things we care about in the end? Yep. Great. And Mimi, can you remind me again what time we're shooting for the break, just so I can kind of.
Yeah, we had the break scheduled for 11:05, somewhat arbitrarily. And I think we got you started a little bit earlier, so we could just say 11 if you want, or whatever.
No, that's fine.
You know.
That's fine. I was thinking maybe what I take us through kind of the schedule, and maybe that's a good break before we kind of come back to the second agenda topic. Okay. So research questions. Okay, so what I tried to do is to say, okay, at the highest level, you really have, given the task, there are kind of 6 big questions you're trying to answer. You know, one of just really about sort of financial foundations of just trying to understand kind of the current situation, given the questions that we have, right? There are then a set of questions around revenue design, legal compliance. There are questions about impact, right? How do any of these things change payments in the financial situation of households, employers, and other types of payers? There is a set of research questions related to startup, operational readiness, system transition, and scenario planning, and then ultimately about sort of evaluation criteria and potentially governance of the plan moving forward. So this isn't sort of mutually exclusive, but I tried my best to say, okay, like, you know, given those research, those tasks that you've been charged with, how can we kind of maybe organize this into something a little more dimensionally sort of distinct that we can then ask questions below. So here's, I'm going to take these one at a time, and I kind of want to just pause and make sure. There may be some small things or things you really want to highlight that are really important. So I think the feedback in these questions are we generally seeing the right questions? And then are there specific things we want to, any gaps in what we might be asking? And then are there any specific things you think are really important that might be embedded in kind of the larger question? Go ahead, Cheryl.
I just wanted to note on your first question, I just want to say that we're not redoing the attributes or the principles. We're just taking a fresh look. We always said this was a living document, so we're just taking another look at it and connecting the attributes and the principles with the deliverables and how we're going to move forward. So I just wanted to say that right at the top.
Thanks, Cheryl. Yes, and again, these questions aren't new questions. These are ones you've obviously been dealing with, but I think I'm just in the sense of just I think Mary Lou said in clarity, I understand kind of what we're doing, what's been done, how can we organize all that work into some work product and documents that people can see. I think what we're trying to do is just help bring everybody so we're all kind of have the same kind of, we'll call it sort of literacy with respect to the work that's been done and that what has to go forward. Charlie.
Yeah, I'm not quite sure I understand what it would mean to review the essential attributes of a sound and sustainable financial plan. Hopefully that doesn't take very long, and hopefully it's keyed upon particular concerns or questions that you might have.
Yes, exactly, Charlie. So that'll be the part after our break. I have some thoughts around taking that working draft and trying to advance it, so we can have that conversation. But you're spot on. Okay, financial foundations, right? We talked about signs. I want to take the work that you did around the sustainable financial plan, and I think I have some ideas to kind of turn that into the next draft that I think will be very helpful as you move forward. But then you have a question, right, that is charged, like how much is currently being spent in healthcare in Oregon and by whom. Charlie's done some great work from there. We're trying to help organize that. But I think what we want to know is, like, are there additional questions? And we can get into this in terms of the meeting plan a little bit. But I think the idea is really try to take that and turn it into a product. Like, here's what the task force did. Here's what we think. And maybe there are still some remaining questions where you want us to dive in a little more so that everybody feels like they have a good understanding of current spending. Go ahead, Charlie.
Yeah, and related to that, and also I guess related to the number one, among the things that has not really been well enough explored in the how much is currently spent is the uncertainties of those estimates. And so it would be nice to work with you on getting some estimates of, well, how uncertain are we about these things? So get essentially confidence intervals, I guess. So thanks.
Yeah, no, my colleague Will Terry, who is on here, has been digging into a lot of that past work as well as the work you've done, and we'll definitely want to be reaching out to you because we have some questions. But I think the idea, yes, is to kind of get as best of understanding of kind of where the money is, where we have pretty good certainty, where we don't, where we think there might be some variance. What does the future look like? Is to kind of ask those questions. Go ahead, John.
Yeah, on number two, just a quick, the word spent, does that include reserves? The issue of reserves has come up more since we started. And, I think a question is, what's being reserved at a hospital level, at a plan level, at a provider group level? What are those reserves for? Are they there for healthcare costs? Are they for risk? Are they for retirement plans? What are all those reserves for? And I'm not sure we have a good understanding of all those reserve issues, and I think it would be good to include those in the word spent. Follow me?
Perfect. We'll add that to kind of the investigation. I think it's a good question, John. Go ahead, Charlie.
So related to the reserves and also related to sort of what the task or the governance board might decide to cover. Structures and equipment is really a tough thing to pin down. How much is spent and where's it coming from? And so it seems like that is one of the biggest uncertainties is how do you estimate what's currently spent and where it's coming from? And it's unclear whether the governance board is going to recommend that the plan cover that, but for equity purposes, many of us think it has to. So anyway, that to me is going to be a tough one. I'd love to work with you guys on trying to figure that out.
You're on the committee, so you will. But thanks, Charlie. We'll add that to the list of questions. All right, John, you got your hand up again, or is that from the previous? Okay. Right. Great. Obviously a big one, and I think this is squarely in Milliman's work here, but in the other committee, but basically operations, how much is this thing going to cost, right? Your idea, I think the most basic way to think about it is like, how much money is in the system? How much money do we need? And are there gaps and or the last question, efficiencies, right? That we might think about as its own source of sort of resources that can be deployed. And here, right, we'll try to figure out how to sort of operationalize that question, because I know administrative costs have been a thing that has been a question here in this group, and we'll have to figure out how to operationalize that as a specific piece of analysis. Go ahead, Richard.
So Charlie's already developed two major models, the whole cost model through 2023 and the whole revenue model. when I say the whole, what I mean, it's a comprehensive draft of the models for both cost through 2023 and revenue through 2022. So when we say how much will the universal health plan cost on an annual basis, well, that's been so one thing is Milliman doing that, or are you doing that? So that's because I look at the descriptions of what Milliman does and what Echo Northwest does, and I'm not sure, and I can't tell the difference in all.
Good question. Really good question. And Mimi, you should probably chime in here, but I think cost is coming from the Plan Design and Operations Committee, of which Milliman is supporting, because part of it depends on what's covered, right? And some actual analysis of utilization. And I think of that as sort of squarely in kind of Milliman's side of the thing. Like what is it? What is it going to cost? Echo is really in the sort of side of, okay, you have these resources, right? How much can you, given the sort of fiscal federalism of state, local, as well as sort of private payer piece, how can you sort of deploy those sources onto that cost structure? And are there gaps in sort of meaningful ways? And then I think the ERISA payroll tax question, as well as other tax subsidies, are in our space as well. So think of it as sort of we're trying to take the finance and revenue questions and map them onto a cost piece that is being developed somewhere else. Mimi, please correct me if I'm wrong in any of that.
No, I think that's absolutely right. And I think that also is some of the space that the board is going to end up working in, because as people have commented, one committee recommends one thing and another committee says, we want the plan to look like this, and finance and revenue says, yes, but you have this amount of dollars. And I think that's where some of the board deliberation is going to come in, with all of this information together, and then to send back recommendations to finalize, like, okay, this is the vent or the window of space that you have to make these recommendations. So I think it's all sort of a yes and kind of thing.
So does Echo Northwest then apply the revenue model to the cost model?
I think it's a simple way to think about it.
Yeah. And is Milliman, again, you're not for Milliman, I don't expect you to represent Milliman, but for the committee, is Milliman doing the cost model? Because Charlie's got, we've had multiple drafts of that. We've been working on this since August. So we have a cost model. Of course, plan design can always come back and say, we're going to add this feature or take away this feature or add a copay, but that's a tweak as opposed to a completely developed model. So is Milliman going to be redoing the cost model, or are they going to extend Charlie's work?
I
don't have an answer for that, but Mimi, sorry.
Yeah, and I might ask Ken. So I will just say first off, like the actually contract has not yet quite been signed with Milliman. So I think some of these questions, Richard, are still to be completely developed. I think just as Echo Northwest and all the consultants absolutely have access to review all of the information, that all of the work that the committees have done. And then, so I don't want to for them, and then we'll take all of that work and go from there in the most expeditious way.
Yeah, Richard, from my perspective, we want to build on everything you've done, but then also apply our professional eye around sort of like, hey, we have some questions, or maybe here's some ways to improve it, right? I mean, that's part of our scope here. But also I think part of it is to kind of help bring the linkages of work that's in other committees, so that you feel well informed on those things, and then vice versa, you can provide that feedback back. Okay, Charlie, and then Cheryl.
Yeah, related to number 4, I'm guessing you're already thinking about this, but among the existing spending sources could potentially be what comes, how much does local and state government spend for their employees' healthcare? And if we went to a payroll tax, how much would they spend? And almost surely it would be less. And then is that something that we'd try to recoup, or is that something you just say, no, we're going to actually allow local governments to spend less on healthcare? Anyway, that to me is a source of existing spending that has other implications for decision making as well.
Yeah,
thanks.
No. Great comment, Cheryl.
We haven't addressed I don't believe in the models that we've been discussing so far. A contingency plan in case Medicare and Medicaid change substantially, like in other words, they're defunded substantially. And so I just wanted to put that on the table as another model that I think we're calling it the contingency plan. And this is something that we've agreed on as a committee and the board as well.
And obviously, if you have something that you thought of once you digest this a little more, you can go ahead and send that on to Mimi and Kim, and we'll definitely be able to kind of get that and part of our sort of thinking as we build out kind of the research plans as part of this work. Okay, so next big question, revenue design and legal compliance, right? So what's the tax revenue mechanism that are available to you here, given Oregon's existing tax structure? Given the sort of potential, the nature of potential any gaps and or substitution, right? Are there things that we care about in terms of yield adequacy, equity, economic impact, and volatility? This, I'll say, question number 2 is a sort of very specific question as part of our scope that we have to sort of address. And then obviously legal constraints, particularly ERISA, that should be addressed in structuring sort of new revenue streams here. We expect some support here from the Department of Justice in Oregon to help us think through some of that legal. We're not lawyers or any experts in administrative law, so we'll have to understand kind of some of those specific nuances. But to me, those are the 3 big questions, but any other big ones or sort of nuances here we should be paying attention to. Charlie, go ahead.
Related to number 1, so there's another tax that's probably going to be really small that I think should be under consideration at least. And I'm pretty sure that Eco Northwest has done some work on this, and that's lodging taxes. And what I'm thinking about is it's one of the few ways, if we don't go with the sales tax, which a lot of us don't think we should, but if we don't go with the sales tax, a lodging tax would be a way to get a little bit of money from out-of-state visitors. And one excuse for doing that would be to say, we need to cover the costs of emergency care for out-of-state visitors. And so perhaps that's a goal for how much we want to raise from there. So to me, it's something else, another one to look at. And again, it's probably pretty small, but I think it's worth looking at.
Great. John.
Yeah, on number 2, I assume that within equity or economic impact, that includes the regressivity or the progressivity of a certain approach. In the task force, we did look at revenue approaches that were very different by income level, and that was really revealing information, and we really haven't to the best of my knowledge, specifically looked at that, and I'd just like to ask that that have a priority.
Yep. Yep. So in the tax world, there are a pretty set standard of sort of criteria that one should look at. The big ones here of yield, like adequate, right? Are you raising enough money that you need? Some people call it yield. Volatility, right? Is this kind of like really elastic with respect to what the economy is doing, right? Or is it kind of like, dislocated in certain different ways? And that depends on the structure. And then I kind of put economic impact as sort of like, how did burdens change relative to other policy, right? So if you think of it as like, some people say, oh, this tax makes us less competitive or more competitive if we change it in certain ways. But what you alluded to is one of the big ones, equity, right? And the 2 dimensions of that are vertical equity. So think of that as ability to pay relative with respect to your income, and then horizontal equity. So basically within classes of individuals or population groups, are people treated the same? And those are the ways we'll be taking a look at it. So thanks for that comment, John. Okay, any other questions on sort of revenue design, legal compliance? I will move on to impact analysis. So here, this is really strongly related to a lot of the revenue plan design. So think of this as very specific analyses around revenue design. And so here, right, how would different financing mechanisms affect individuals, households? And so we talked about a calculator. These can be more or less easy, difficult to design. When for 4 years, I was on a staffed a bicameral bipartisan tax structure work group in Washington that ended a few years ago with some changes in revenue proposals. But what we did in that case, we built actual models where people can enter in information. Here's some of my tax filing status, right? This is how it may change. And so depending on the proposal, these things can be easier or harder to do just by allowing people to sort of interface with it. Like, here's what I pay today. If we changed it, here's what I would pay in the future. And so some of those sort of engagement tools are available to us, and we'll figure out sort of the right way to deploy that. But we will be building those kinds of analyses for you, so you can kind of understand sort of how different proposals or changes might rate there. Go ahead, Cheryl.
So in terms of the cost calculator, this came up at the strategic planning retreat too. We're talking about individuals, households, and employers. Is that correct? Okay.
Yeah. So think of it as basically everybody who's putting money into the system today, in some way or fashion. And as you can imagine, some of that gets complicated because of the fiscal federalism aspect of this, where you do pay money to the federal government in the form of different kinds of taxes, and that money gets allocated in different kinds of ways to individuals, right? That isn't necessarily the same as sort of like, hey, here's my contribution to an employer-sponsored healthcare plan, right? And now it's just part of my, a tax that I pay, right? The nexus becomes a little more diffuse. And so depending on sort of those analyses, we'll have to kind of pay attention to those different kinds of things. Okay. Second question, what changes in financial liability, coverage, administrative burden are expected on key payer groups? This is really kind of your equity question, John. And then I think part of those analyses, right, are then asking a set of questions around strategies that can mitigate potential burdens, unintended consequences, right? So certain things you might be thinking about, do people get tax credits perhaps, or, in lieu of some progressivity issue, right? Or that's how you choose to implement the progressivity issue through tax credit exemptions. Or maybe things are tougher for businesses, so you don't want them to sort of have to bite the bullet all at once. And so can you find like a way to phase that in over time so you're not disrupting kind of the economic competitiveness of the state? So to me, these are the three big kind of impact questions we'll want to be dealing with. Any other thoughts, questions you have right now? Otherwise, obviously, we'll take them as going forward. All right. Oh, go ahead, John.
Yeah, I've mentioned this before. I believe it's worthwhile to look specifically at Medicare. And that what we're doing here, Medicare is really individual insurance. It's funded by, well, to some degree, federal government taxes, but then also by individuals. And, we'll be offering almost certainly, I think, a better benefit for Medicare folks in terms of dental, vision, other sorts of things. And whether there should be kind of a Medicare trust approach for the folks who on the day the plan starts are not 65. So that when they turn 65, some of that risk is financed by contributions they have made all along the way, just like we all do now for Medicare. And so that eventually it becomes easier and easier to fund that difference in Medicare costs between, the federal Medicare and Oregon Medicare. To do so through an Oregon Medicare payroll tax. But it would be using good insurance principles. You ask people to start making a contribution when they're young. And you make sure via a trust mechanism that it will be there when they turn 65 to finance that those costs. So I just wanted to get that on your agenda.
Okay. No, thanks, Sean. I think I remember the very first meeting that I joined, you made this point, so it's stuck in my craw. Great. I'm going to move us on to the next one here. I think this one's fairly straight up, but we'll have some questions around like, well, doesn't just magically appear over time. So how do we sort of think about this transition from our current state from a finance and revenue perspective. And so think about this as within each funding bucket and source, right? We're trying to think about like, what are the startup pieces? Are there reserve pieces? What are the administrative complexities of making this transition? Because it's likely to take some time, how do we sort of pre-fund it, right? And where is that coming from? Are we borrowing it? Is it from a specific one-time source, right? So there are some big questions here that we have to talk about in terms of this. And I think, our goal will really be to give you guys information as well as sort of strategies around how other states have handled these kinds of questions. But think of it as a set of frameworks that you can deliberate and kind of talk about pros and cons of approaches. Maybe there's not a single recommendation here, but maybe a priority, like it'd be great if we could do this. If we can't do this, we have to do these things. Go ahead, Cheryl.
I know John's brought this up before and I think he mentioned it again today, but so are the reserves of the current health plans on the table to pre-fund this new plan's reserves?
I don't know the answer to that, but I think it's a question we'll want to dig into. So, great. Oh, go ahead, John.
Yeah, I think we can assume that on day one, all the existing health insurance plans would still be responsible for costs incurred prior to day one, and they would have to have reserves that they would ensure those would be paid. I believe that when you do an analysis of the reserves they currently have, their reserves will be in some cases far in excess of that number. And so to me, the question is, what happens to those reserves that are in nonprofits, funded and in part, sometimes significantly, by public funds, meant to be there for the community to use? What happens to those? Do they all become conversion foundations? And we have a number of philanthropic kind of conversion foundations, or is a reserve fund created to stabilize the single payer into the future? And it's not just the health insurance companies. In the hospital industry currently, they look to have 200 days of revenue in reserve in order to get the best bond rate. Will they need to have that kind of reserve in a single payer setting? You would hope not, since you would hope the single payer setting would be far more stable and predictable. But anyway, it will be the monies in reserves that are there after they've paid for the claim run out. What happens to those reserves?
Yeah. So I would say I kind of have these as distinct startup operational readiness, but they're really part of a larger system. And so, we've been asking these kinds of questions. And so, but to me, I think they are distinct enough. We want to kind of like sort of think of as pre-seed, and then how do we actually sort of think about different scenarios? And John, I agree, the expenditure question, the existing reserve question wasn't actually something on my radar, a lot of this. And so I think there's probably a legal question in here as well as an actual sort of like nominal question that we have to address in these things. And imagine the answer is probably fairly messy. All right. So I'll just pop these up here. We've been talking a little bit about these things, but to me, these are kind of questions and deliberation that we'll have to kind of bring information to you. So in terms of like, well, how has Oregon done this in the past? How have other analogous types of ventures done this? And are there kind of lessons learned here? What is so unique about the healthcare aspect of this that we have to pay attention to? So to me, I think these are kind of all sort of, a very sort of bucketed set of questions. But to me, the transition question will be very interesting because I think we're going to, this will be, in your terms of your task, my sense, a place where you have sort of a, principles, preferred scenarios, key challenges, kind of insights that'll be important for the board to understand sort of how this may happen given the current situation. Go ahead, Cheryl.
So for a phased in implementation, are you talking about something like, I don't know if you were listening in on our strategic planning retreat when Governor Kitzhaber talked about phased in? Is that what you're talking about? Like first you go with, Medicaid and the exchange and very small group plans, let's say that's the first phase, then throw in Medicare, then last the self-insured. Is that what you're talking about?
Yeah, to me, I think this is the part where we have to really talk to plan design and operations, right? To understand like, you know, how can this really work? But I think exactly that part where the governor was speaking was part where I was paying attention to, like, yeah, like it's like the enormity of kind of moving everything over day one, right? Is probably, a very large piece, but maybe there's a more phased in transitional piece, but that maybe is more operational administratively doable, right? But the financial part may be much more complicated.
Yeah, right.
That's the part where we have to interface, understand what the proposals are, to talk about the pros and cons and challenges of doing so, particularly with respect to some of the other things you're talking about. Like, well, if we do this, like, we can't really implement sort of equity in our sort of revenue proposal because of XYZ or whatever it may be. But that's just some forward thinking around with how that may look.
So just to be clear, then, is this our charge to propose whether it's phased implementation? No. Who would that be?
With respect, I think, Mimi, I think that's the plan design operations.
Both?
Yeah, it would be both.
Okay.
More under the operations, actually, but.
Okay, fine with me. Thank you.
Go ahead, John.
Yeah, just certainly acknowledge the transition issue is interesting, messy, challenging. I did want to remind folks that at the Joint Task Force, ultimately the task force's decision is that self-insured employers would have the choice to move. And presumably the environment would be such that they would have incentives. They would be better off moving. Now, nothing happens in this country 100%. And so I'm sure some employers will be very eager when they hear about this. We've had employers who are very supportive of single payers, we can't wait for this. And so my guess is thinking about ERISA and thinking about all the variables, there'll be some folks who want to do it right away as soon as they can, and other folks who will take their time, and we'll just have to see.
Right. I'll move us on to our last big questions, but it's really evaluation. And I think this is just to kind of seed a little bit is the conversations you've had thus far on the working draft of the sound financial plan is how can we organize this in a way that provides clear criteria to weigh some of these trade-offs in performance, right? And then that second big question here is really about moving forward, right? As you think about that transition and potential phase in, like how does one sort of govern and make tweaks to this to sort of respond to challenges or optimize key principles that you have on the revenue side? I'll pause here. Any other kind of big questions that have been floating around your conversation, or does kind of get to most of it? Great. I'm going to move us on to the meeting plan here. And so call this a working draft, but taking these questions and the work you've done, we've tried to sit down and say, let's not, these are blown up here, a little bit bigger here, but just a quick recap. But we see kind of trying to stick to our 8-meeting kind of template here that gets us through at the end of the year. UHPGB staff have kind of given us supplemental meetings into interview time that if we need them, we can try to use them. But I think ultimately we're trying to, a month is a good cadence, but also gives us time as sort of a staff to you all to kind of do some work and then get them out to you in a time where you have some time to digest that beforehand. So, so just really quickly, I mean, today's meeting is just to kind of we'll call it level set. Meeting 2, I think we want to put a bow really on the current healthcare spending. So a lot of the questions that both Charlie, John have brought up, and Cheryl, right? We want to sort of like just make sure we have a good understanding, revisit some of that stuff. So we have some work to do between now and our next meeting to kind of really get that in shape. But we really want to think about is like, hey, there should be a memo that we all feel like is a, you know, coming out of that meeting 2 is a great encapsulation of kind of what we know around the current funding and some of the key issues, so that we can always kind of go back to it as sort of a foundational thing. We can amend it if we necessary. Things pop up, oh, we should probably think about this. But I think that's the idea. So I would say meetings 3 and 4 might be interchangeable a little bit, and a lot of this depends on sort of where plan design operations and Milliman are, but relative to sort of this piece. But I think it'd be good to either from some of the existing work that's done, kind of have a sense of sort of where we think the number is relative to that piece, right? And so either that happens in meeting 3 or we kind of swap it with meeting 4, because I think meeting 4 we can build on kind of the current spending and talk about revenue mechanisms, right? Both in terms of tax structure and making sure people have a good understanding of Oregon's tax structure and some of these other potential revenue strategies, and talk about sort of legal considerations, arise of compliance in that piece. Coming out of that sort of meeting 3, 4 jumble, right, is a very specific thing where we talk about sort of revenue trade-offs. And here, right, this is a big part where we're doing a lot of that analysis, like how do burdens change between employers, employees, households, other kinds of payers. So you have a sense of sort of like, given potential revenue strategies, here's how they may affect these different kinds of groups. And then meeting 6, right, is really then to pull all this together and start defining kind of like a revenue strategy. To me, meeting 6 is a critical one where I think we have some kind of scenarios around here's how we could fund this program, right? Some ideas in very specific ways. And then 7, particularly talking about sort of some of the transition stuff. But then meeting 7, right, once we kind of flesh out those sort of scenarios, those ideas, we can do some system comparison and talk about it and really kind of narrow down, I think, on the key aspects of your deliverable, right? Here's the money, here's what we think the cost is, here are our preferred ways of doing this and some of the trade-offs perhaps with different ways of doing things. And then meeting 8 is really the last little bit where we try to tidy everything up. So this is kind of, I think, a biggest picture kind of flow of taking kind of the research questions and trying to map them to specific meetings. And I have this in a little more detail, but this is sort of the general outlook. And I know everybody's got questions because I think there are some really good ones here that I have as well. But we'll go Charlie, then Richard, then Cheryl.
So I want to suggest that what's listed in meeting 1, 2, 3, and 4, we've already spent a lot of time in this committee, and those are probably going to take about at most 25% of the time of what is in meeting 5. And I would much prefer that we essentially say meeting 2 is going to do what 2, 3, and 4, what you think needs to be done for 2, 3, and 4. And then we can start on what you say is meeting 5 a lot sooner. I mean, there is no way that we can accomplish what's there in meeting 5 in the same amount of time as what's in meeting 2, 3, and 4. I mean, individually meeting 2, 3, and 4. And even together, I think all of meeting 2, 3, and 4 together is going to be a lot less time than what is required for meeting 5. And I would also say that in meeting 5, it's not just the stability, equity, and economic impacts. It's the nature of the tax structure. It's we have some things that we need to be talking about seriously that are not really related directly to what you're talking about there. I mean, they're sort of related, but there's a lot there, and I just do not see there's any way that we're going to do that in one meeting or even one meeting and another supplementary meeting. And I do see that we could do 2, 3, and 4 in one meeting. Yep. So that's my comment.
No, that's super helpful, Charlie, because I think, part of here is to take a look at some of the meeting conversations and the deliberation and the materials. And I agree, a lot of that's already been done. And so what we want to try to do from the feedback today is sit down with Mimi and Cheryl and tweak some of this. So appreciate kind of that piece, because I think, those are things you've talked about, and just kind of in a vacuum, this is how I would kind of lay it out. But I agree, you got a lot of work to do. And part of it here is also we have a little catch up to do too, to kind of get some of this in sequence. So part of it is just trying to move these pieces around. But I hear you on sort of the work that's been done, because we've seen it in some of the products and pieces. But I do think there's still some work that has to kind of come back for you guys to tidy some of that stuff up. So we do want to try to get it, but we'll see if we can squeeze it all into kind of next meeting as best we can. Go ahead, Richard.
Yeah, I put up my hand before I heard what Charlie was going to say. 100%. We've already done 2, 3, and 4, at least gotten a major start. This stuff is iterative and to say we're going to get all the costs done and then move all the revenue, unrealistic in my mind. I'd say part of meeting 2 is to have you review the cost model and say where you think improvements need to be made, or amendments, or refinements. And then the second part of the meeting is to look at the revenue plan, and so that we develop them both together over the next several meetings. So first half cost, second half revenue, that sort of thing, and go and do them iteratively each of those meetings. So I strong recommendation to modify the plan I see on the screen now. Thank you.
And we'll get into a little more, but Richard, you did bring up something that is important to talk about here, is because it's so hard to get anything done in one meeting, right? Because you have feedback, right? Do this, feedback. So everything about it is basically every meeting is kind of stretching into 1.5, maybe 2 meetings, right? Where you're kind of hey, we have some feedback, and it comes back at the next meeting, and maybe still comes back a little bit in the third meeting. So everything has a little bit of its cadence. It's not like all finality, but
Sure.
it's trying to get it. And you'll see this a little bit in the specific work plan, is like, I'm trying to also then incorporate decision items, so that you feel like, great, this is done, or this is done if we do 1, 2, or 3. And so we can take some of this feedback and rework this program for y'all. And it'll change a little bit as Milliman gets up to speed. But I think I hear you right here, is like, and I feel it too. Like, we gotta, anything we can kind of tidy up quickly, we'll try to do at meeting 2. Go ahead, Cheryl.
I'm all for trying to squeeze 2, 3, 4 together with some wiggle room in case it does take us a little bit longer and then we need to move a couple of things to the next agenda. I mean, I think we have to be flexible too, but I'm all for trying. And then I have just a couple of kind of weedy questions, I suppose. One is, how are we going to schedule in the meetings we were going to have with plan design, or at least one meeting, to kind of see where we're at and compare notes? And is that still going to happen? When would that be? I know that it seems to me when we're in board meetings, the other committees are looking to us, to react to what we've come up with, or to take our proposals into consideration for their proposals. And I know communications as well is like waiting for us to have, they're waiting for direction from us. So I'm just trying to incorporate in our timeline, some very direct interaction with these 2 committees in particular within the process. So that's my first question.
I think there's a Mimi question, but I would say yes. One of the things we haven't quite done in this schedule is that interaction piece, because I think it's still.
I'd like to just be able to tell them something at the board meeting. And then the second one is very much just a scheduling process question, and that is, I noticed that our main meetings are held, like, for the most part, either 2 days, or in this month that was actually after the board meeting. And I think if we want really quick feedback, or relatively quick feedback from the board, we're going to have to reschedule our finance and revenue committee meetings for, like, maybe the second Tuesday, or we'll have to figure out what will work. But that way we have a week to get our proposal to the board, and then it will get to them in time, and then the board can actually provide, like, a thumbs up or whatever. And so we can continue with that work right at the next meeting, like if we need to go back and redo something or just move on, whatever. But I think it's problematic that we're meeting like 2 days before the board meeting for the most part. So I feel like we're gonna have to reschedule all of our committee meetings. And I would love to schedule all of our meetings out through December anyway, just have that all on the books, so.
Yep,
I know
we'll take
that's
that.
not like something, Morgan, you can answer, but I think it's more of a
I
me.
think it's a Mimi question.
Yeah.
I will definitely take that on as an action item, and meeting with the board chairs actually a little bit later today, and also the chair of plan design, just to ask those specific questions about the intersectionality and do we want to have crossover meeting and things like that, and what we think will be the most efficient use, because of course everyone's time is really pretty constrained, and I know we appreciate so much everyone volunteering their time. So how is that best communicated? So that's, thank you, Cheryl.
I know we had tentatively planned to meet in June or July, but it's just, it wasn't set in stone. So, yeah, thank you.
John. Oh, you're on mute, John.
I generally agree with the comments that we've covered meeting 2, 3, and 4. I have 2 comments though. In terms of meeting 3, I have found it frustrating to not have that actuarial estimate. I mean, I'd like to know, what does Milliman think vis-a-vis the Optimist estimates? What's changed? What did Optimus not consider or overvalue or undervalue? To me, that would be very helpful. And that gets at the impact of, in the task force, we had 4 or 5 issues that were billion-dollar issues. No cost sharing, which I don't think there should be. That's a billion-dollar issue. Not covering non-residents who are employed in Oregon. That was $1.5 billion. And the list goes on of those big issues, and some sense of what people are thinking about those big issues, I think is really helpful. The other thing I don't see anywhere on the meetings is a more detailed discussion of administrative services and estimate, developing a range of savings that could be done with around administrative services, and I think that makes anything that makes our revenue job a little bit easier is to me on the table for us to urge be on our table.
Great. Oh, thanks, John. So I will go and rework some of this based on it. So we'll run through this, but what I tried to do is, and I think what we're going to try to do going forward is give everybody an updated sort of agenda so we can see the purpose, the main purpose of an agenda, any kind of key decision points or action items that we need the board to take. And so part of this is just to sort of, obviously build the breadcrumb trail where we've been and where we need to go, and feel like, I know you have a document there with some checklist pieces, but very much playing the similar role, right? Are we sort of sequencing all the discussion and decision points for you here as we kind of try to get to the end of the year. So meeting 2, right? I think and I'll just kind of go through this, is to kind of go through these pieces again. Or not go with them again, but try to find some finality, making sure any lingering issues or questions are being addressed, like administrative cost pieces. And so obviously we have meeting 3 on the cost. And so we'll have to figure this out, because in terms of what we have now, so some of this will be, we're building the plane while we're flying it aspects, particularly given the work that's happening in other committees. And so to the extent that we can have good enough information for now, and then to replace that with better information going forward, but we know that's a kind of key variance or uncertainty we have to build into our deliberations. We'll try to do a lot of that as well. And so here, I think I'll rework kind of 2, 3, and 4 here, but just to kind of go through these pieces, right? We're kind of trying to cover the amount it's in the system, how much it might cost, but then also to sort of do a little more expansive work on the revenue side. And I've looked at some of that pieces. I think that may be a meeting itself. I think there's a lot more to discuss on the current tax structure work as well as potential revenue options going forward. So we might just I'd hate doing this. I'm thinking out loud here, but maybe try to collapse meetings 2 and 3 a little bit into meeting 2, and then meeting 4 really start the discussion around revenue design by talking about kind of current structure and revenue options going forward. So we'll build on everything that's been done and not duplicate it. So think of it as basically everything we're going to try to do is new information for you in those meetings. Meeting 5 we talked about here is the sort of moving into sort of basically revenue design options. Meeting 6 really talking about testing around the impact of that. So again, we may stretch this into two earlier and then 2 to 3 meetings because we've given ourselves a little more space by trying to combine those meetings. And then meeting 5 is actually September. Oh, what did I do here? Did I duplicate a slide? I might have duplicated a slide. And then start our discussion on impacts and startup planning, move into understanding kind of the comparison. So basically thinking about the way it is today relative to ideas you have for redesign of that system and thinking about sort of pros and cons. So I think in sort of making sort of the revenue to sort of plan design piece, meeting 7, maybe meeting 6 and 7 is really about sort of looking at outputs for comparison. So you guys have that piece. And then, flowing in that sort of set of decisions, right? We're really then moving into meeting 8 I think really is the last meeting for any last piece. So to me, there is what I would propose we do, right? We're building this report, but basically meeting 8 is really kind of the last little bit of kind of refining our report, making any changes, and then for you all to make the final decision points around approving the road's recommendations and documentation and submitting the report to the overall board. So that's a little quick. We were going to spend a little more time on that, but I think I'm hearing kind of your interest or desire, and I would not desire, but just the reality of the things you've done and trying for me to kind of rework it. So I would say one of the things I'll have here is a revised sort of set of meeting agenda topics for you all as well. And in the memo that was sent to you, right, there are sort of discrete kinds of staff reports that you'll get as sort of actual sort of deliberative material that accompany these agendas. Charlie, then Richard.
So I just want to suggest another possibility, and we have the supplemental meetings, a potential one in June, and to me, that would be a good time to try to do quite a bit of what is scheduled for meetings 2 and 3. And so that maybe in the regular meeting of June, we are ready to go into meeting 4, things that you think might take a little more time. I mean, I also think that you could maybe even get into meeting 5 things in June as well, because to me, it's not clear that there's that much difference between 4 and 5, but maybe there is. I'm not quite seeing it now. At least, because we have had all sorts of presentations about possible tax structures, and so there shouldn't be that much more there. So anyway, I think that we should look into maybe a supplemental meeting in June to try to move things along a little bit better.
Okay, I'll sit down with Mimi and Cheryl, and we'll try to, when we revise this, to see if we can utilize some of those things. Go ahead, Richard.
I think at least my expectation is that this committee will be meeting twice a month. We call it the supplemental meeting, but there's so much to do. Again, I can't speak for the committee. It's not my job, but I think we're going to be needing to meet twice a month. Will you be joining us twice a month to iteratively improve both the cost model and the revenue model? And that's probably a Mimi question, but thought I'd asked.
Hey, Richard, this is Kim. I'm actually going to jump in. So back when the board chair and co-chair wrote the contract or the RFP, rather, the request for proposal, they only asked.
Sorry to
Can't
interrupt.
hear you.
Yeah, we're having a challenge hearing you. Sorry.
Yeah, we could hear you for a second, then you got really quiet.
Okay, thanks. Hopefully this is better. Back when the board and vice chair wrote the request for proposal for this particular contract, they only asked the consultant to attend the monthly finance and revenue meetings. And so I know that this is disappointing to you, but as the contract administrator for a little while, I want to protect Echo Northwest's time and just remind the committee that Echo Northwest is only contractually obligated to attend the monthly finance and revenue committee meetings. If they are gracious and they choose to attend the supplemental meetings, we will work with Cheryl and Mimi to make sure that that's reflected in the expectations from them. But contractually, Echo Northwest only needs to attend the monthly finance and revenue meetings. Okay, thank you.
Go ahead, Cheryl.
I just want to reiterate my comment about how I think probably the meeting that is right now called our supplemental meeting needs to be our main meeting, because we need the time between our meeting and the board. And since I see that it's already on the calendar, I think we should just extend that meeting. But I can talk more to Mimi about that. I just wanted to mention that could be our main meeting, and that would be when Echo Northwest joins us.
Richard, I'll just say from my perspective, right? I mean, we're here to support you guys, and whether that's in analysis meeting time, we'll try to figure out a way to make it happen. And I appreciate Kim being a great contract administrator because the lines get a little blurry here, particularly from a sort of, I'll call fairly mission-driven kind of organization here. We want to see this be successful, and so we'll figure out a way to support you all.
Thank you.
Okay, great. Well, unless there's any more questions here, I think our action items with respect to this is we're going to take that memo and revise it. And we'll call that kind of our best working draft of the schedule. We'll sit down with Mimi and Cheryl, and we'll try to figure out a meeting, more logistically, a meeting plan that kind of lays this out in a way that makes sense with all the other moving pieces as well. So look for that coming from both from staff, and then we'll support that. Okay, Mimi, you want to take a break now, and we can come back to
yeah, it looks like it's just 11 o'clock. Can people come back at 11:10? And we will see you then.
Thanks, everyone.
All right, everyone. It is time to get started again, and it's 11:10. Welcome back, Morgan. How's your voice?
Yeah, when I went to get a drink of water, so I'm ready to go here. Thanks, everybody. I think that was the most laborious part of the agenda, and hopefully this can be a little more thrifty. So one of your work items, right, was to sort of create this sort of sound financial plan document, and you've done that at one of your earlier meetings at the end of last year, beginning of this year. I can't remember exactly, and it's been sitting there as kind of a living document. And we want to for this conversation, what I'm looking for here is a little bit of permission and a little bit of direction to take this to the next draft, to evolve it a little bit. And I think for 2 to 3 purposes. One, I think it would be a good product to share with the overall board as well as the other committees in some fashion. And then I also think we want to sort of get it in shape that will help guide our conversations around revenue design, as well as some of our future, I'll call it, comparison work. And so, so here, I want to just kind of maybe kind of step back a little bit and kind of see what it looks like. And I have some sort of that asked a little bit of permission for us to kind of take a whack at that for you and bring it back to you in a new version, but then also get some of your feedback. So with that, I took a look at the most recent version of that document, and what I see are really kind of 4 products in there. There are some sort of, we'll call them general requirements, expectations amongst yourself and staff and consultants with respect to the type of work and how to do the work. You do have kind of what I'll call the guiding revenue principles, which look a lot like standard kind of tax principles, but you've also amended those in ways that reflect some of your conversation. And then the next piece, you do have kind of a healthcare revenue for Oregon kind of discussion component of that document that I think what I would do is elevate some of that into its own product that can be shared with the board as well as the plan design and operations committee. I think you take a lot of sort of your thinking here, and I think that would be a very important shareable piece. And then you have kind of the I'll kind of criteria, scope, and sort of ideas that I think get lumped in kind of what I call kind of a new plan development section. So when I step back, this is kind of how I see that current draft. And what I think what we can do is take some of this stuff, evolve it into the next draft with some of your discussion and feedback, and then also use that to share. And so just in a little more sort of like detail, right? Your general requirements are the foundational sort of technical standards you have around the financial analysis, your expectations, and so these are things that I think are important. Some of the conversation you've had today, key aspects, I wouldn't really call them necessarily principles or criteria, but I think they're really sort of good sort of standards and direction that are really important for us to sort of embed in our work, right? And we can kind of move that piece. You then have kind of the guiding revenue principles, right? Some of these are very sort of, they sit at a little different elevations. So one of the things like we could do is kind of maybe talk about them from sort of like a revenue perspective versus kind of things that are more, revenue funding perspective, things that are more like, I will call them sort of a financial in essence, or like more like about sort of how does one manage cash flows and deploy expenses. So I think we can kind of speak to a little more clarity in some of those elements. Then, right, you have some very specific parts around understanding kind of the healthcare revenue landscape that you've done, right, and aspects of that I think we want to use to sort of deploy in thinking about the current services. But then there are also really some parts in there that are really important in terms of plan design. And then I think here I think is some places where we can share information as well as collapse some of this into some of our revenue pieces, and to make that document a little more sort of communicative and cohesive. So so my questions are really kind of anything you want to sort of you've thought about that document, anything you want to revise, is there something missing? Perhaps not. You've had that conversation. We don't need to open that back up. But I think to me, would you give us direction and license to kind of dive into that document a little more, and to sort of tease out some things that can make it a little more shareable and organizable, but also I think sort of practical, because I think you want to use a lot of that as sort of a unified sort of framework or criteria for evaluating different scenarios. So those are kind of my questions, Charlie, and then Cheryl.
So could you go back to maybe I think there's a second group of things related to that one, yeah. So I think there was one more that is to me really important. No, that's the right side.
Yeah, sorry.
One more item on there that's really important, and that is it should not privilege any sort of income, and so all income should be treated equally, independent of the source or something. I forget exactly what word we use, but
yeah, this is my sort of quick summary of that larger document. So I might have missed some of that in translation.
Yeah, and to me that's a really important one. Yeah. So I again, we can look at that document and find the words we used. But yes, I would like that to be included for sure.
And Charlie, generally, you'd be fine with us taking a crack at trying to organize that into a little more of a work product that's shareable.
Wait, here, unmute. Yes, I would be. I'm curious what that would look like, but yes, I would. And I guess a question is that if you do that, is that something that can be shared publicly prior to a meeting so that we can look at it and give feedback prior to the meeting?
Oh, for sure. I
Yeah.
think
Okay.
the cadence would be, you give me the okay, give me some advice, guidance. We'll take a crack at that, share that, and we'll have a small agenda item on anything, or people could submit, track changes, comments to that.
Thank you.
Go ahead, Cheryl.
I don't have anything to add, but I do like the idea of reorganizing into these buckets and using, using the principles and attributes as a set of criteria for evaluation. That makes a whole lot of sense to me. And then it would be really practical, and a good use of that document that some members of this group worked really hard on. So my question is on the, let's see. On the plan, let's see, not this one. Could you move a slide or two? It's not that one. Next. Oh, new plan development. That's it. It seems like some of this overlaps with the plan design committee, so I wonder how we would address those issues, or does it matter?
Yeah, good question. I was thinking of kind of maybe think of it as trying to pull together, not lose anything that you've done, but keep it in one document, but organize it. But I think trying to push on some of the application criteria, evaluation aspects of it, I think that's a part where we can add some value there. I think then there might be another, I'll talk to Mimi and you about this, but I think there's also maybe some of that I think is very specific. I think some really good things that can be shared with the board. I mean, everything can be shared with the board, but very specific kind of things with plan design and operations as well. And so and be good to kind of maybe think about like a memo there that captures some of that. So, and just kind of pulling out those elements that are relevant for other groups at this plan, at their stage of
like, for example, the very first bullet,
Yes.
So yeah, I think this is great. I'm all for it.
I was wondering if I could just ask a clarifying question. Charlie, this is to your point. I just pulled up the document and I was wondering if what you were referring to was the avoid unequal burden, to the extent possible, avoid imposing an unequal tax burden on wage income versus other types of income, if that was what you were alluding to.
Yes, that sounds right. Yes.
Thank you. Thanks.
Cheryl, do you want to like call to see if everybody is okay with us taking that crack? We heard from a few folks, but I want to make sure I've got a strong enough consensus.
Sure. I'm seeing Mary Lou here. How do you feel about this? Okay, good. Charlie said he was okay with it. How about John? Richard? Bethany? Jeff?
Yes.
Oh, great. And I think those are all the committee members who are here. Is that right, Mimi? I think I got everybody.
I think you did.
Okay.
Great. Excellent. Thank you for that decision.
Thank you, Morgan.
Cheryl, that was a lot faster than I was expecting. So sorry, I'll turn it back to both you and Mimi on the rest of the agenda. But otherwise, I do say we're really excited to kind of really be up and running and working with you all, Cheryl, and staff here to kind of move all this forward. So thank you very much for the conversation today. Oh, Mary Lou.
I just want to say thank you. As a new member to this committee and to the board, I'm running fast trying to catch up. And I know that a lot of work was done by the members of this committee, especially a few of them, and I'd take my hat off to Charlie. And so I like the fact that this is respecting that work and trying to, use it, move it forward at where it needs to be, etc. And I just want to say, Morgan, that I'm impressed with your presentation, your positivity, just your general demeanor. I've worked with a variety of consultants over my life, and thank you.
Well, I will take that as great praise. Thank you very much.
And I echo all of Mary Lou's comments, both to Charlie and Richard and others, and also to you, Morgan. Okay, so we're on to meeting reflections and next meeting topics. I would just say we definitely need to figure out the scheduling of the committee meeting, so we'll do that in between. I'd like to just, I know that we've been so kind of a little bit, well, hamstrung a bit by public meeting laws, and I want to make sure we are all, we all know exactly how we can share information. I think that, I mean, frankly, I believe we could review, information in between. It's just a matter of how we would share those comments or not, you know, that we have on certain work products of Echo Northwest. So I just want to kind of reiterate how we can do that, and that's still, and it's okay to look at or accept information and maybe provide feedback, whether that's to the staff or to the consultant. I'd like to kind of go over that to make sure what we can do in those in the information sharing space in between.
I mean, absolutely. It's certainly acceptable to, of course, share the information when it's available from our consultants. And if so, of course, as you know, what we is not acceptable is if there is a quorum of committee members for them to deliberate. In other words, talking amongst oneself or amongst yourselves around a specific topic, if that is seen as deliberation and that's done outside of a public meeting, that is not acceptable. However, it is either, you know, certainly sending out the information, and then of course at this, you know, that's what this meeting is for that public deliberation. If people would like to email comments back, that is also acceptable as well. Those can be shared, but they would be shared and then posted because it would be shared with everyone. So those are a couple of options.
Okay, thank you. And I just want to note, so we are going to figure out the schedule from now, well, yeah, June through December. And so we'll get that on your calendars. And again, I'm going to propose that we use the supplementary meeting as our main meeting, and we can decide on whether there is another supplementary meeting or not. I think that's something we need to talk about in between. And then there were a lot of comments on Morgan's slides. I'm assuming that he has taken those notes, so I won't go over all of that, but there was a lot of feedback, and I'm also happy to talk with Morgan and Mimi in between to make sure we got everything. But does anyone else have reflections? I see Jeff has his hand up. Go ahead, Jeff.
Thank you. I don't know how, and I don't see how anybody can draw a distinction between deliberation versus my picking up the phone and calling Charlie and saying, "Hey, Charlie, that was an interesting comment that you made in your presentation or in your analysis. Can you tell me more about it?" So I'm going to rely, perhaps wrongly, on my continued good judgment as to what needs to be deliberated versus what needs to be talked about, just trying to get a better understanding. And if that gets me in trouble, then so be it.
I think you are absolutely correct. The missing piece of that was a quorum of members. So, and as you know, if you talk to Charlie and Charlie talks to Mary Lou, and then Mary Lou talks to John, and then they talk with Cheryl in an email string, then it becomes a quorum. However, certainly getting information, one committee member talking to another, if it's not a quorum, it's not a public meeting. So
just to follow on to that, say, for example, I call up Richard to say, "Hey, interesting comment you made. Tell me more." I can't control what Richard does, nor do I want to control what Richard does if he talks to another committee member. So it's, it kind of reminds me of trying to figure out how to dance, how many angels are going to dance on the head of a pin. I'm just going to try and do the best job I can and talk with everybody I need to try and help my understanding to be a good member. That's my standard.
Absolutely. And of course, this is a great forum for that as well in these public meetings.
It is a great forum, but it's not the only forum.
Richard.
Yeah, that's why I think it's really important to have the extra meeting each month, just because you need the feedback and need the iteration. And since we can't communicate generally freely between meetings, which is fine, that to wait a whole month just to get feedback back and forth with our isn't really adequate, in my opinion. So shortening the sequence between meetings would really help. Thank you.
Okay. Mary, did you have anything? Mary Lou, I mean.
Well, just the fact that as quickly as possible, I know it doesn't seem like, as the retired person here, that I should have such a terrible schedule. But between other volunteer activities, grandparenting, you name it, I kind of had been blocking out those Tuesday things. So, but I was confused between mornings and afternoons and 2 hours and 3 hours and whatever. But if we could, as soon as possible, get that so that I can, if I've already got things scheduled, I can try to move them around. Thank you.
Yeah, we'll work that out as soon as possible. And I need that myself because I get booked up pretty fast. So totally get it. Does anyone else have any reflections from today? And then we can go into next meeting topics as I understand them. I think Morgan may need to help me with that or Mimi, but I have a couple things that I wrote it down. Any other reflections, Mary Lou?
Well, I came into this meeting a little concerned about what seemed to be somewhat duplicative of what I understood had already been done. And so I was kind of like, and I did send a quick note to Mimi late yesterday when I saw this and kind of went, oh my gosh, are we starting over again? And for someone like new to me, that's okay, great. I'll, drag me along. But for everybody else, I'm kind of going, but I think that the presentation today and the talking and people reflecting, and Charlie and John and Richard especially kind of giving their feedback on things because they've been instrumental in this whole piece, I'm feeling much better. So
good. Yeah, no one wants to start this work over again, including myself.
Yeah.
No one's got time for that. Okay. All right. So in terms of next meeting, what I heard was that HMA is going to lead a discussion. Is it on administrative costs? That's what I didn't quite get that.
Yes, they were going to do a literature search regarding if there's any, updates on the information around provider-cited administration costs. But that would be that's the one that's scheduled for a month from now. So
right. Okay. And we'll always have a progress report from the other committees, just so we keep in touch with what they're doing. And then of course, Morgan kind of laid out the scope of the work and into 8 meetings. And it sounds like we're going to try to do as much of the meeting 2, 3, and 4 as possible in that large, in our regular meeting. Is that correct? Is that how I should understand it? We'll do what we can do. Okay. Richard?
Yeah, one item that's still out there, it's been out there 6 or 8 months, is we need something from Oregon Justice Department on whether we can build a healthcare trust fund that isn't subject to the kicker. Especially now that Governor Kotek, well, I won't bring that up, had the issue today about news about the kicker, but we've been asking that for a long time. We really need to get that tied down. It really is significant. It will have big implications for what we do.
There was some response about that. I believe it was from Bruce from the operations committee, that because of the structure of the entity, that we could set it up as not being subject to a kicker. Does that sound right for this, Mary Lou and Mimi? That's what I thought.
I think so.
Yeah.
It is an operations question for sure. I don't think that it has been completely vetted or solved. So I'll definitely make a note of that, Richard. Thank you so much, and
Thank
make
you.
sure that we have.
That's what I remember them
Good.
saying, like, oh, that's resolved because of the structure of the new entity, but yeah,
Good.
maybe it's not completely resolved. Charlie?
Yeah, I don't think it's related to the structure of the entity. You know, it's a constitutional question. It's a legal question that we really do need an answer to. So I'm going to reiterate what Richard's question, because it's really the question is, can you raise money with a tax that's based in part on income or totally on income, that is not considered to be general fund or subject to the kicker by the Oregon Constitution? And so it doesn't matter what structure we make. It's the original raising of the money question. And I really do think we need to get that answered. And it's, you know, again, it doesn't matter what structure we set up. Well, it might matter what structure we set up, but that's not clear. And that's what we need to know.
Okay.
Thank you. Yeah, that is, I'm actually talking later today with the operations committee
Oh,
chairs.
good.
So absolutely, it has a big star right now. Thank you so much.
Great. Anything else as far as the next meeting or anything else for that matter? Richard?
Yeah, if we're going to do, if Milliman is responsible for the actuarial aspect of costs, we need to get them in front of this committee right away too. Echo Northwest was gracious about trying to decide how the work goes or making their comment about that, but we really need to have this talk with Milliman and find out what does it mean to do actuarial analysis of the cost model that Charlie's already built.
Okay, yeah, good point. Hey, Mimi, do you know when Milliman's starting, or have they started already? I don't remember.
You know, I think, and Kim can help me with this one. I think it's in like the contract is in the sort of second or third phase of iterative review with the DCBS legal team right now. So
Okay.
we're waiting, bated breath. We are waiting with.
Do you have any idea, like, if they'd be available in June, if we were to invite them and put them on?
That is, I don't know about their availability for this meeting in particular. Oh, and Kim, thank you so much, please.
Yeah, Mimi, I'll pipe in. I actually reached out to, this is Kim. I reached out to the project manager listed on the contract and asked if Milliman would be interested in doing sort of a pre-formal contract meeting with the board and the committees. And they said, no, thank you. We're going to wait until the contract is fully formalized.
So maybe June might be a little bit early, I'm guessing, and it might be July then. We could add them to the agenda, perhaps.
Yeah, we'll definitely keep space. Well, keep
Okay.
space on the agenda, and then also I'll note that for when we have
Yeah,
our kickoff.
tentatively. Okay, thank you. Charlie?
So I guess we haven't quite made a decision about whether or not that first like June 2nd meeting will be the longer 3-hour main meeting or not. But this, again, sooner that we can find out, I guess it's,
Yeah, that's
Yeah,
going to be, that's going to be my recommendation. Because it gives
Yeah.
us enough time to actually put forth a proposal to the board, and we can find out the same month if it's going to fly or if we need to
Yeah.
change anything. So,
and I guess, you know, it's going to be partly up to Morgan and others in Eco Northwest about whether they can join that meeting or not. But it would be good if well, it'd be nice to know as soon as we can.
yeah.
I had another comment related to a tax question, and this is actually more back to really back to the tax document that, or the revenue principal document that we're talked about. So, and it's also related to the legality or a legal question, and it's related to federal tax expenditures or not having something not taxed federally. My assumption is that a payroll tax, an employer payroll tax, would not be subject to would be considered a cost to an employer, and so therefore not subject to income taxes. And I guess we need to know if that's really true, or if that's what other legal scholars would think is true, I guess. And the other part of that question would be, suppose there were an employee payroll tax. Would it also be true that that would not be subject to federal income tax or FICA? And my guess is the answer is it would be subject to those. But it would be nice to know the answers to those. Thanks.
Is that a question for now? Like, is this something for Morgan, or do we just add it to the list of things? I'm just asking, I think Mimi and Morgan, if that's something to answer now.
No, I don't know. I don't have an answer for that now, but I think
Okay.
it's a good question, and we'll add it to
Okay.
the list of things we're tracking.
Okay, good. Just wanted to clarify. John?
This is general comment time, right?
Yes, that's right.
Well, I'll try to do this quickly. So this is the Annals of Internal Medicine this last month. Now, it's a print version. So this study that I'm going to mention has been out there, I think, online probably for a month or more. The study's title is Insurer Level Estimates of Revenue from Differential Coding in Medicare Advantage. So this is a very credible research team at UC San Diego who looked at Medicare Advantage carriers and their coding approaches versus traditional Medicare in 2021. So, it's 4 years old. Let me just read you a part of the results. This is all about risk and coding in ways to increase the risk, which, because Medicare Advantage is, quote, value-based payment, unquote, the more risk you have, the higher the payments are. The average risk score at United Health Group was 0.28 higher than it would have been if its plans had coded identically to traditional Medicare. In contrast, Kaiser Permanente coded only slightly more intensely than traditional Medicare. As a result of differential coding, Medicare Advantage plans received an estimated $33 billion in additional payment in 2021, $13.9 billion of which went to United Health. This is what we're facing. I mean, this is incredible corruption. So United Health is basically asserting that it has 30% riskier patients than everybody else. And, it's relevant to some of the conversations we've had about getting a Medicare waiver. I think the degree of corruption going on in Medicare Advantage is just incredible. It's also, I think, representative of the challenge, but also opportunity we have to sit down with the delivery system and develop a way to pay them that gets rid of this kind of corruption. It's just so unsettling, the challenge that we have, but also the opportunity. Thanks.
Hear, hear. Any other comments, reflections, ideas for topics, Mary Lou?
I guess I just want to respond to that, John. And, back when I was really naive and maybe still am, and was starting Care Oregon, risk adjustment became a really big topic and something that I spent a lot of time involved in. And indeed, not wanting to be corrupt at all, but wanting to acknowledge the difference in our patients versus some of the other plans. but it is tremendously complicated. It is tremendously possible to game it. You know, I guess, God, that was 20 years ago. It's like I didn't think I was going to be back in discussions that had to do with risk adjustment again. But anyway, here I am. So thank you. I just had to say that.
Thank you, Charlie. And maybe I've got to leave for just a second. I'll be right back, okay? But go ahead, Charlie.
So I have a general comment about risk adjustment, that it is not possible to do it in a reasonable way. It's that is not gameable, and it's been tried for, I don't know, 40 years now, and we know the evidence is clear. You cannot do it in a reasonable way that does not lead to incentives to game it. And so it should be avoided at all costs. So anyway, I'll stop with that.
And you know, I can't resist. I wonder what the impact of getting rid of risk adjustment would be when it came to how much revenue would we need. You know, I hate to think we're using revenue that supports this kind of corruption.
And I guess this
Mary, call on Bethany.
Okay, I'm sorry.
Thank you.
I just wanted to give my 2 cents that I don't completely agree with Charlie on that statement. As a medical clinician, there has to be some risk adjustment because otherwise you can't, it's difficult to place a value on how difficult a patient is. There has to be some adjustment.
Thank you, Bethany. And then Mary Lou, pardon me for interrupting.
And I guess that's why I believe everybody needs to be under the same tent. When the pool is everybody, then you don't have this, you know, risk adjustment thing. It has been taken care of. But when it comes up, when we're all dividing up the pool and we feel our organization has been unjustly burdened by more costly people. And that does happen by marketing, lots of different things. And so that's why, partially why I agreed to kind of get into this whole stuff again when I had pretty much thought I was done. But it has to do with getting everybody under the same tent.
Thank you. Charlie.
Yeah, and it's not just getting under the same tent. That's the risk adjustment for insurers. There's also the potential need for it with providers, which I think is what Bethany is referring to. And that can be avoided by using fee for service. There's potential places where you could maybe have a little bit of the payments based upon a per capita, but that can only be done for things that are very routine and well known, and you know, the only risk adjustment you would need to do is based upon demographic factors and not something else. If you need something more than demographics, then I think you should really avoid it. But so potentially for maybe there might be some place where per capita payments are not bad, but in most cases they would be, and you know, we need to avoid that. That's my feeling, but that's really more of a plan design and reimbursement question rather than a finance and revenue question. So
yes, and that's on the docket for plan design committee, and certainly for that's a big discussion at the board level as well. So fee for service versus alternative payment methods. I'll just say that it is a big topic. Absolutely. Any other reflections? Next meeting comments? We did not receive any requests to provide oral comment today. There are some public comments, however, that are posted. So if people have the opportunity when we go onto the website to take a look at what other members of the community are talking about and questions that they have.
Hey, Mimi, I'm back. And I just wanted to say, I was going to ask if there was public comment, but also wanted to say thank you for the really great discussion today. I feel optimistic about our path forward. I appreciate Echo Northwest and looking forward to the next 8 or so meetings and to get our work done. So I appreciate that. John, did you have something?
Yeah, I would just like to sort out, I had trouble downloading Charlie's spreadsheets. For one reason or another, my system wouldn't download them. I could look at them on the screen, and could we think a bit about, in Charlie's case for his comments, incorporating these as documents of the committee, and making sure that the committee members can all see them and all more easily?
Yes, John, that's an excellent point. I did notice that the hyperlinks weren't working to that document, so that's why it was uploaded separately. But we'll keep workshopping that, because I agree, things are still a little bit cumbersome. So thanks for that feedback, and we'll make sure that all of the things that are shared in an accessible manner. So thank you so much.
Okay, thanks for the comments, and just again, we'll get this schedule figured out as soon as possible, so that it's all on your calendars, and we'll go from there. Anything else for the good of the order? Mimi, anything? No? Okay.
Thank you.
Then we'll adjourn and have a good rest of the week, everybody, and thank you for your commitment to this committee.
Thanks, Cheryl.
Thank you. Bye-bye.
Bye.
Well, everyone.
Take care.
Bye. Take care.